We begin by telling you that nursery, primary and secondary schools will be reopened on September 6th. However, secondary schools will be done in accordance with the rollout of the vaccination being done by the Ministry of Health. This is according to Minister of Education Priya Manichan.
All schools will reopen on the 6th of September. The school term begins on the 6th of September, but secondary schools will reopen as the vaccine rolls out. And so even as you hear the individual plans for secondary schools, that will take effect only once the vaccine program has been rolled out by the Ministry of Health, who is working in collaboration with the Ministry of Education. As we said before, reopening will look very differently than it did in September 2019 for the 2019-2020 year. And reopening will look differently for different schools at different levels. It may look different even for the same levels, same nursery in the same region. So one nursery school may open one way and another one may open another way. You will hear in detail this afternoon how each school will reopen and what our plan is to counter what we know happened, the learning loss, as well as to arrest the...
Presently, Pfizer vaccines are being administered to children aged 12 to 17 years old. Schools have been closed since March 2020, when Guyana recorded its first few cases of the infectious disease. During a press conference today, Minister of Education Priya Manichan stated that keeping schools closed will affect students. Unvaccinated healthcare workers who were locked out of the Linden and Georgetown hospitals and who did not produce a negative PCR test on Thursday will not be paid, according to Health Minister Dr. Frank Anthony. The minister was speaking during his daily COVID-19 update. Anthony said he hopes good sense prevails.
And if they don't get vaccinated, then the option would be that you can present your PCR results and come to work. If you don't want to do any of those things, then you'll be marked as absent and you would not be paid. And that's our position. So I hope people understand this. If people are not coming to work, then in some cases it might cause us to reduce some of the health services that we are currently offering. At the two major institutions where we are affected, that's in Linden and in Georgetown, though the administration of those two institutions have taken some consideration with maybe the diminished capacity of our staffing there, and they are taking certain measures in place to still have the services continue. We would be closely examining every day, every shift, what is happening, and we'll take those decisions as is necessary.
On Thursday, Dr. Gerald Ford said the locking out of healthcare workers was unlawful.
According to the Essential Services Act, you cannot lock out any healthcare worker. Like the same way we cannot strike, just like that, they cannot lock out any healthcare worker. It's a person's right under the Medical Practitioners Act if they want to take this vaccine or if they want to refuse this vaccine. So why are they forcing it on people? Under the Occupational Safety and Health Law, it says that if the employer wants you to take a test, they got to foot the expense for the test. So why are they asking us to pay for these things? And the science that they're following, that they say they're following, say that the unvaccinated persons equally carrying this thing as just as the vaccinated persons. So why is it they're locking out all of us? Why are they discriminating against people? We cannot take this type of discrimination because one today going to be the vaccine, tomorrow something else they're discriminating about.
Dr. Anthony said healthcare workers are putting themselves at risk.
Because if you have an unvaccinated healthcare worker, they're putting themselves at risk because on a daily basis they're interacting with a number of persons from the public. You don't know the status of those persons, whether they're positive or not. And the only way that you can protect yourself from infection, apart from using PPEs, is to make sure that you're vaccinated. So the stand that some people have of not protecting themselves runs counter to all the medical education that one would have received during their years of study, and runs counter to the science.
The minister is urging healthcare workers who have not been vaccinated to closely examine the issue. The medical practitioners have maintained that they are not opposed to vaccination, but it must be a matter of choice. As the government continues to roll out its vaccination exercise, opposition leader Joseph Harmon says by now, with thousands of Guyanese already vaccinated, he would have expected to see a decrease in the infection rate. He posited that the government started a vaccination program from March this year, and until now, the figures have not declined.
In Guyana, it is totally different. We have started a vaccination program since March of 2021. And until now, we can see a dip in the numbers. In fact, the numbers keep going up and up and up. And we have over 446,000 doses that have been injected into the arms of Guyanese. And still the numbers don't show any change in that. So the ministry has to give a proper explanation why these numbers keep going up, and you're vaccinating people all the time, and the numbers of vaccinations going up, but the numbers of infected also keep going up. Today we have over 24,864 persons that are infected. The number of persons who have died as a result of COVID is 606. So this is not something that you play around with. This is not something that 3 or 4 ministers or former ministers sit in a room in some ministry and decide that the numbers are important. We are not just numbers. These are live human beings that we're dealing with.
Harmon was speaking at a press conference today. He noted that the APNU AFC is not against vaccination, but does not accept mandatory vaccination.
But certainly what we do not accept is the fact that these vaccines can be made mandatory for people. We believe that there has to be a choice, and people must be made aware of their choices. And so we had a look at what has happened since vaccination started, because the government's PR machinery has rolled out in a very aggressive way against the opposition, saying that we are against vaccines. We have made this very clear, and I repeat it, that we are not against vaccines, that we support vaccination, but we believe that the education of the population is important. We have a particular issue with the Sputnik V vaccines that were acquired from the Sheikh in the United Arab Emirates, and those concerns have not been met as yet. The public has still not been given advice on that.
Already Guyanese are pushing back against mandatory vaccination, with many saying it's a choice they should make voluntarily.
For these and other stories, do visit us at our website at www.rdproductionsgy.com.